So we're done with our patient. Sorry, I don't have gloves on. Are you okay with that? Okay. We're done with our patient. This is the tip that you've used on your patient. We'll pretend that this is full of powder right now, but I'll show you how to fill the powder and whatever. You're gonna take this off. This is the handpiece, whatever handpiece that you're using. This does not get sterilized. This just gets wiped down with your whatever.
You got the cloth.
Yeah,
the
Advana Clear. Oh, you guys are good. That's very safe for this. So just wipe this down. Something else I always like to train on is we tend to take our hoses and pull this way. As you're wiping down a hose, fold it in half and wipe it this way. On any of your equipment, there's less chance of you pulling out any of this from here, so and exposing any wires. So this will save the tubing if you kind of do this as you're wiping down your tubing, okay? So you just wipe this down. This is between patients. This is your handy. This is your handpiece. All you need to do with this, in your little box came a little thing called an Easy Clean. Did you see this? Fits in the back of this. I recommend these kind of syringes. This is called a slip tip syringe because it fits in very tightly into the back end of this handpiece. Fill it with water.
Distilled? No. Okay.
Well, water is
doesn't
fine.
matter, right?
Doesn't matter if you have distilled water, well water, whatever, because it's going to go through the sterilizer anyway. Suck this up. Go in here.
Does it need to be
Push
pretty
it right-
warm, the water?
No.
No?
No, it can be really when you're just preparing it to go into sterilization, that's all you do. Maybe twice, squirting it twice, just to make sure you got all the excess powder out of there. Wipe this down, put it in your sterilization area.
Does it go in the ultrasonic?
You can, but you don't really have to put it in, I mean, unless you're using a cassette, which is something also very, very nice to store these in a cassette, little handpiece cassette, because then they're together all the time. You don't have to worry that, if you accidentally drop it or whatever, it's safer that way. But it can be put in the ultrasonic if you need to, but you shouldn't have to, okay? So just wipe it down, then ready to go. To bag and to autoclave. When you get it out of your autoclave or your Statum, this is something that's really key. Take your air and water syringe tip before you place it on the unit. Dry the center area down with air. The air and the powder go down the center portion, and then, if you look at this, you can see that there's an air and water, or a hole in the center, and then the water encapsulates it. So if there's any condensation remaining, which happens when they come out of the sterilizer, it's still damp a lot of times. Just make sure that that's dry, because it'll prevent any clogging that might occur. Okay, that's one of the biggest things that I've seen in the field too, that people forget to do that. If you do get a clog, you can just use this, and hot water will break it up and push it through, or soak it in hot water, and then clear it out.
So I think one of our